It's 9 o'clock. Is everybody ready? Call the meeting to order. The moment of silence and pledge allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yep, can we have a roll call, please?
Nicole Tickus. Here. Zach Rudat. Here. Dick Stallone.
Here.
Brian Cunningham.
Here.
Andrew Showers.
Here.
John Williams.
Here.
And Dwight Washington.
Here.
Any changes to the agenda? I'd like to move the health department up underneath the administrator's report.
Other than that, sir, only as noted on the copy before you, request to remove the annual report from the transit system. There was scheduling miscommunication. They will be here next month.
Okay. Entertain a motion to
I'll make-
approve as amended.
So moved, Mr. Chair.
Been moved and supported. All in favor?
Aye.
All opposed? Motion's carried. Meeting minutes from March 25th, Board of Commissioners meeting. Pleasure of the board.
A pleasure.
Any questions? Any changes? All in favor?
Aye.
All opposed? Motion's carried. Next, we have one communication, Eagle Township Resolution adopting an ordinance 03-2025, amending the interim zoning ordinance.
Move that we accept and place on file.
Second. Been moved and supported. All in favor?
Aye.
All opposed? That motion's carried. Next up, Administrator Controller Report.
Thank you, Mr. Chairman. I have no additional items to report other than what was discussed at last week's committee meetings.
Thank you, sir.
I'll be brief.
Okay. Liz?
Hi, good morning. My name is Liz Braddock. I'm the health officer for Clinton County, working for Mid-Michigan District Health Department. So in my report for April, I wanted to mention that we do have a measles outbreak in Michigan. As of last Friday, we were up to 9 cases. I'm bringing this up since it is a very transmissible disease. If you're in contact with somebody that has measles and you are not vaccinated, 9 in 10 people will get sick. We have vaccine in the health department. Should you wish to come in, we will accept walk-in. So if you want to just walk in and get a vaccine, or if you want to make an appointment for your family, we have vaccine. And if the need arises and we need more, we can come out to a community if there is a concern. Bring this up since MMR is the vaccine that is used to prevent measles. I indicated in your report that we do have vaccine coverage data for those kids entering daycare and entering school. We would need to get it a little bit higher in Clinton County to get herd immunity. So always working on offering vaccines. Childhood vaccines are always available at our health department should the family wish to get them. Moving along to county health rankings, excited to show that in the 2024 county health rankings, it shows that Clinton County is one of the healthiest counties in the United States, and we're also very healthy compared to the rest of Michigan. Unfortunately, this is the last year that University of Wisconsin and the Robert Wood Johnson Foundation will be issuing this county health rankings. When we look in the past, Clinton County is always around 2 to 5, top 5 then in Michigan for being the healthiest. This means that we live longer and that we live healthier. And some of the items that we take into consideration is access to recreation, access to healthcare, access to dentists, how far do we travel in the car, how much alone time, how is mental health of those who reside in the county. Just to give you some examples, our strength include that we have a very low percentage of uninsured. much lower than those who live in Michigan. We have much less preventable hospital stays, and we have a less percentage than the national and the Michigan average for those households with severe housing problems, and we have less children that live in poverty. 7% of children in Clinton live in poverty compared to 18% in Michigan and 16% United States. We always work on getting those lower, and when we look at grants and where we can pursue more funding for programs we always look at health rankings and see where the needs are in our community. And then that last one, I was going to give a shout out to environmental health programs. Right now, bats seem to be the thing. Bats carry rabies, so if there is a resident who is sleeping and finds a bat, what we advise them, don't smack it in the head, but save it, keep it, bring it to the health department. We can send it into the Bureau of Labs at Michigan to get the rabbit or the bat tested for rabies to make sure that the bat isn't rabid. And that's all I have, and I can accept any questions. Yes.
What should an individual do if they know that they were exposed to the measles? What should they do?
They can give us the health department a call, and one of our communicable diseases nurses will ask the questions. You know, where were you, where at, and then ask about vaccine status. And if they don't know, we can look up an individual's vaccine status to see if they have been vaccinated. And then if they have been vaccinated, we tell them to monitor themselves for symptoms for 21 days. If they haven't been vaccinated, we offer that if it's within 72 hours of the exposure, they can come in, or we can consider prophylaxis or just monitor.
Is there any number of days for isolation?
So the person who has measles is contagious for 4 days before the spots and 4 days after, but you can be contagious for 21 days after exposure. But typically, illness is around 11 days. I just want to mention that our medical director, Dr. Morris, does a report on her March 2025 report was on measles, and it's on our website. Plus, we have a link on our website to the state dashboard and the state information regarding measles.
Okay, great. Thank you.
Sorry. I have a question on the bats. Can you bring them in dead or alive? Is it you just bring them in a shoebox, or
We bring them.
you have a lot out?
We have instructions, but you need to. It needs to be euthanized. We can only test dead bats.
Okay.
We need to keep the brain intact.
Brain intact. Okay, don't whack it in the head. Gotcha.
Yeah.
Okay. Thank you.
We are open between 8 and 4. So for the last 2 weeks, we've had a nurse available every day. Yes, go ahead and call for Friday. We may not have a nurse on Friday just because we have training, but call ahead and we can get you in.
John?
I had my parents and my mother-in-law, they got the measles when they were young. If you had the measles when you're, young, do you have to worry about later on getting a measles shot?
You are considered immune if you
Are
can
you?
show that you've had the measles.
Okay. And the vaccines, how long do they last?
Forever.
Okay.
It's 2 doses, you get 1 dose, gives you 93% protection. 2 doses is 97%, and it's a lifetime.
Okay. All right. Thank you.
Mr. Chair,
Yes.
Liz, has your association provided you with any documentation relative to legislation that currently is in the Senate for septic system inspections? Am I throwing you a curve,
No,
or?
not at all.
Okay.
We have been told that in 2024, the legislation fell and it no longer moved forward. Senator Singh is moving it forward again, and the document has been shared with Eagle, and it should be shared with local health department, but there has been some reluctancy. And the idea is that they're going to try again to get a program in place, and instead of tie-bar, there would be one bill moving forward. There was a House and a Senate, and they'd like to get one.
As I recall, the expectation is that health departments in the state of Michigan will be given that responsibility. Is that correct? Of doing the inspections, assuming they give you funding?
Well, the assumption is there should be funding, and as it went forward, there was no funding. It can be on the health department or could be a private contractor that has to report to the health department if those inspections were to happen, yes.
Yeah, not putting Liz on the spot, but this was tried 10 years ago, and it never went anyplace, and now it's up again for consideration. I don't, I know Senator Singh, I believe, is the progenitor of that bill. I don't know in the House who is pushing it, and I don't know what the governor's thought is, but if you hear something, please let us know.
We will, and we didn't have an update. We did not have an update this month to the Board of Health.
Okay.
We are very concerned because it's an unfunded mandate. However, the idea of a statewide code is something worth pursuing just without, we need funding.
Because that has big implications for those who live in the more rural parts of Clinton County.
Absolutely, yeah.
This is the septic stuff?
Yes.
Right. There is it's called Michigan Saves, and they do low-interest loans for the septic systems around the state. Have you heard about them before?
Yes, so the concern or the issue we have with Michigan Saves is that they provide funding for those who want to replace the septic systems. The septic systems that would qualify for that would need to be engineered here in Clinton County because of the soils and because of the way our environmental regulation. So you're looking at getting an engineered system. So your funding would be, you're requesting probably tops 25,000 plus money to repair a system up to those standards of an engineered raised bed or something with pre-treatment. Where our code allows you to put something 2 feet to the water table.
I wanted everybody to know that this is not a county problem. This will be controlled by Eagle, I think, and the work distributed to mental health, to public health facilities.
Yes.
So if the rumor gets started that we're doing something nefarious again, we're not.
No, it is the state mandate, just like our food code. We inspect restaurants under the Michigan food code, the same, yeah.
Yeah, thank you.
It will be a county problem if they don't provide the funds. Because the last time I talked to environmental health, it was going to require 7 bodies.
7 bodies at least, because of the amount of septic systems we have in our community.
Yeah, last I heard, the funding was less than enough to actually do the job.
Yeah, it would be less to actually even have a database in place. So that's the first thing they're working on, is a database to be able to get this together.
Is it the Michigan, the only, like, of just a handful of states that don't have regulations?
Yeah, Michigan does not have a statewide code. Every district or every health department or county has their own environmental health regulation. It's been like that, and it does work. I mean, there's been a lot of information out in the press that our environmental health regulation doesn't work. We pass accreditation every year, and we have since I was the environmental health director in 2017 here, and we've always passed. We have a really strong program and a really well-trained staff. It's not the health department's fault that we don't have a statewide code. That's the way it's been.
Anything else for Liz? Belt? Thank you, ma'am. Have a great day. Public comment. We'll now take public comment. Please state your name and address for the record.
Troy Stroud, Eagle Township Supervisor, 12320 South Bauer Road, Eagle. So I want to address a comment made by LEAP and some straighten out that at Eagle Township, we have Clinton Catalyst doing our grants, not LEAP. We've only ever applied for one LEAP grant, and they don't come to our meetings. They've not met with us on our grant process. They have no idea what we want other than one grant. Last year, we did 7 grants with Clinton Catalyst, 5 on our own. The Clinton Catalyst comes to our meetings. They're aware of what our community wants and needs. They've been an active part of our community since this has started. LEAP is not. For those of you who don't know, LEAP not only worked on mega sites. They also worked on the failed 425 that was hidden from the township residents. They also failed to share PFAS results with the landowners where it was taken. They also failed to share it with the guard or the township themselves. LEAP has worked in bad faith number of times with the people of Eagle. They lied to us about the mega site and other things with that openly. And it came out that they were multiple times they lied to us. And to date, they've never come to a township meeting other than to represent someone else. So I just wanted to clarify that they're not doing our grant process. We just applied to one grant. Thank you.
Thank you. Any other public comment?
Good morning.
Morning.
I've waited to stand at this desk for a long time. It's taken a long time for me to get here. In some ways, I want to repay evil for evil, but I'm not going to do that. Clinton County Catalyst, thanks for the ringing endorsement, Troy. We do have 2 grant writers, and they're doing a great job with a lot of people throughout the county. Clinton County Catalyst is about economic development in Clinton County. All of Clinton County.
Yep. Could you please introduce yourself?
Sure, you bet. My name's Tim Fair. I live at 15469 Wood Road, Lansing, DeWitt Township, Michigan, 48906.
Thank you.
Yeah, no problem. And I'm here with Clinton County Catalyst. Catalyst has been around 20 plus years. It was started by, of all people, the Clinton County Commissioners and the Clinton County Board Chair, Paul McNamara, at that time.
He was not the chair, by the way, just to correct that. He was never the chair of Clinton County.
You're sure about that?
I'm positive, because I was here.
Okay. Well, thank you, Bob. By the way, your voice is a lot stronger than other people's. You
That's
sound
because
like
they don't have their
Moses.
mics on.
Yeah. No, it's just, I remember sitting in a room, and I don't know if you guys know this, Clinton County has had economic development since the 70s. And some of the people thought it wasn't really doing the job. And one of the things that started out of that was a brownfield redevelopment authority that was actually done by Catalyst. Bob, you worked on this. Bob was on the board for, in fact, if you look at the history, you were on the board for 7, 8 years. Bruce, you were on the board for 5, 7 years. Clinton County Catalyst is helping many businesses here in Clinton County. We're about business, we're about municipalities, and we represent many municipalities, and we're about education. And we represent a lot of educational groups in the county. We're about bringing those 3 together to better our community. I'm gonna come back and I wanna talk about a brownfield redevelopment at the county level. I'm gonna come back and I wanna talk about a land bank. A couple years ago, Shiawassee County, our neighbor to the east, instituted a land bank, and in the last year, they've garnered $700,000 for their land bank. And I know I've talked to some of you, and they say there's not enough blighted properties. There's plenty of blighted properties. That's why we need a brownfield redevelopment. That's why we need a land bank, in my opinion, in the county. And there's lots of people that would concur with that opinion. I don't know if now is a time to take questions, or if you say, no, this is more about public comment, but I would like to, yeah, okay, thank you. I would like to come back and have a longer period of time to discuss Catalyst, knowing what we're doing with, we have 100+ members now in the county, and we're moving forward. And this is all about helping business, and we're doing just that. And I think the county commissioners should be aware of what we're doing, and really, as they once did, we're on board with Clinton County Catalyst. Thanks for your time. Thank you. Yeah.
Any other public comment? Anybody else? Okay, we'll move on. Community mental health, building stronger communities update. Missy?
Hi,
Hi, good morning. I'm Missy Davis, and I am with Community Mental Health Authority of Clinton, Eaton, and Ingham counties, and I'm the coordinator for the Building Stronger Communities Council.
I'm Jason Gilliam. I am a supervisor with the Clinton County Counseling Center, which is the CMH office here in downtown St. John's.
And I am here, I come annually and report out to you guys. I'm so happy to be here again this year. And I'm thankful, first of all, to the Clinton County Commissioners for your annual, I guess I would call it your budget allotment that you give to the Building Stronger Communities Council. That is so fundamental into operating what we do every year. I did put in your packet what it is that we do for the Building Stronger Communities Council. It's just a flyer that gives some of the breakdown, what is our vision, our mission. I know many of you are new this year, which is great to see some new faces. And so that gives a breakdown of our vision, our mission, some of the collaborative events that we do, and then some of our partners, and also an invitation for our June event, which I'd love to see any of the administrators and all of you commissioners be able to come to that. If any of you need me to register you for that, my email address is at the bottom of that. I'd be happy to have you come. We have over 40 people that are already registered to come to that this year. So it's a great way for you to come and see some of our human service agencies and partners come. We have fun, we have lunch, we just network. And so if you have any questions about what it is that we do, we'd love to have you come and see one of our meetings. We meet virtually every month. The only month we don't meet is our in-person June event. And then we don't meet in August because we have our big Project Connect event. And so we're busy doing that. Otherwise, virtually, and I can send you a link to that event or that meeting. And if you want to come and see, we have over 30 people usually attending that. Reports out from our human service partners. Usually a presentation that's from any of our human service collaborative agencies. So anybody have any questions about what it is that we're doing, any of the events that we participate in?
So we got an update from the medical examiner last month, and she had mentioned that suicide rates were higher this year so far than what we saw last year, and that she's seen that kind of regionally, not just in our county. So is there, are we doing anything on that front? Is there steps that we can take to kind of help combat those numbers as a county?
I'm gonna leave that to Jason.
Yeah, community mental health itself is working towards, we're what's called a CCBHC. It's a community collaborative behavioral health clinic. So you're mixing both mental health and physical health together. Part of that initiative is Zero Suicide, and that is it's a training that is certified by the federal government that they give to us, that we're working towards training everybody within the entire agency, from the custodial staff up to the CEO. So that is something we're doing in regards to locally, beyond just offering the services that we have, which are robust. There is, I don't know if there's anything singularly that we're working towards. We're really just going to do the best we can to help the people that we serve.
Say something about the community care center you developed in Lansing.
Could you turn on your mics? Can't hear you.
The community care center that's being developed in Lansing, and how you think that might affect Clinton County?
Yeah, so the community mental health is Clinton, Eaton, and Ingham County. That's the combination of the community mental health we have here. And the community care clinic is going to be on the old McLaren Hospital campus. And what that is, that's going to be it's kind of a stepping stone and kind of a bridge between someone who gets hospitalized at a psychiatric hospital or someone who is is seen at our Bridges Crisis Center, which is kind of a step down. So it's the in-between. It's where people are going to be able to go to, If they're feeling suicidal, they can go, they can get treatment, they can see a psychiatrist immediately, they see a nurse immediately. They'll be able to get clinical therapy, clinical work right there within that building. They also will be able to, it's also cost effective because it won't cost as much as sending someone to the psychiatric hospital. And it's really is, it should be opening about this time next year. We're in the process of redeveloping that site right now. It's going to be amazing, and it's going to really be able to affect folks that are not only in this county, but in Eaton and Clinton in regards to being able to get the help they need and not be able to just send them to the hospital or just put them out in the community where they're going to be, need to be monitored even more closely. So that should open spring of 2026, and I can bring more information regarding the community care clinic to you guys if you're interested. Yes.
Did you say that's going to be at the new McLaren Hospital?
The old one on Green Lawn.
Oh, Green Lawn, okay.
Yeah,
Okay.
yeah. The Women and Children's Building is where it's going to be.
I have a question.
Sure.
Is there a stay limit for that facility when people come in? Because I know finding beds for people is really hard, and especially the longer term. Is there, what is the limit of a stay?
I don't know if there's a limit to stay. It is supposed to be short term.
Gotcha.
So you may have someone that come in and they are not quite psychiatrically hospitalized at that level of care, but they can go there, be stabilized, get some medication, and be able to be put out in the community. That can take 1 day, that can take 7 days. It just depends on what's clinically appropriate.
Not intended to keep people long-term, I guess.
No, absolutely not, no.
Gotcha.
And honestly, psychiatric hospitals don't do that either. I mean, you go to a psychiatric hospital, you are typically, people that go are there for 3 to 7 to 10 days, right around in that time frame. They get stabilized and then they're brought back into the community.
Okay, thank you.
I just wanted to say thank you, particularly to BSCC. There's a number of people who are doing work in Clinton County to make this place one of the healthiest counties in the country that Liz just spoke of. And I really think that the Building Stronger Coalition Community Coalition is really part of, helping people get the social services they need, helping them get to the resources that they need. And it's just really important. And I just want to thank you for doing what you do. And I know from being attending the meetings that it's just a place where, a lot of people who are doing this good work can find communion, can find respite, and can find like others who are on that mission to make Clinton County a better place. And again, I want to just thank you for that.
Thank you, Dwayne.
Last thing for me, I just want to let all of you know that the BSCC, Clinton County, the BSCC, that collaborative is very, very strong, and they are very active, and they are very, very much willing to work together to help the people in this community. I am thankful for your support, and we were going to keep doing our work.
Anybody, anything else? Thank you.
Thank you.
Thank you for having us today.
Next up, zoning items. Oh, Christina, there she is.
All right, so on our April 10th Planning Commission meeting, we had 2 rezonings go before the board. Both of them were voted 7-0, all in favor, none opposed. The rezonings are going from general agriculture to rural residential districts for both of the rezonings. One is in Westphalia for 2.65 acres, and the second one is in Riley Township for 1.91 acres.
Commissioner Hurtkamp, anything to add?
No, I don't. I can just, I think these are really, I supported both of these, as you had mentioned. Trying to remember, did we hear? Yeah, we heard from both individual landowners, so, yeah, and we fully supported them. So, the one there was, I believe, was the parents wanted to, or the individual wanted to move their parents onto the property and build a structure there, correct?
No.
Wasn't it like a barn dominium?
No, that was last month.
No, okay, I'm getting that confused.
So the one in Westphalia Township, it is splitting off the homestead, the house, to sell that and then keep the remaining parcel as agriculture. And then in Riley Township, that is taking and splitting off a piece of property to build a brand-new house, which the original house had burned down.
That's
So
what, that was it,
that's-
yeah, yeah. And then, there was nobody there opposing any of these items, so, and it sounded like all the neighbors were in favor, so.
Do I have any questions?
Just a comment, Mr. Chair. Thank you for letting us know what the vote was, and I would request that, and I realize you've had some changes, that the vote be written into our document. In the old days, commissioners could actually see who voted for and against, and the reason I'm asking for that is it is a trigger for me, particularly after 24 years, to know if there was something that was not necessarily seen as everybody wanting it. And as commissioners, ultimately, we have the responsibility for saying yes to what the planning commission says. So if you just add the votes on these, I would appreciate it.
Would you like to make the motions?
Make the motion to approve PC-03-25, application for zoning map amendment submitted by the property owner, Michael Schroeder, to amend the zoning map and zoning designation from general agriculture A-2 to rural residential low density RR for the following property: partial ID 19-160-035-200-040-00, totaling 2.65 acres, section 35 on Tallman Road, Westphalia Township. And I so move.
Is there support?
Support.
Any other questions?
All right, second is PC,
Holding, take a vote on this one.
oh, sorry.
All in favor?
Aye.
All opposed? That motion's carried.
All right, second one is PC-04-25, ordinance 206-25, an application for zoning map amendment submitted by the property owner Todd Gibson to amend the zoning map and zoning designation from general agricultural A-2 to agriculture, or to rural residential low-density RR for the following properties, totaling 1.91 acres, section 26, vacant land on West Lehman Road, Riley Township. And I so move.
Is there support?
Support.
Any questions? All in favor?
Aye.
All opposed? That motion's carried. Thank you.
Thanks.
Next up, FOIA appeal.
Excuse me, thank you, Mr. Chairman. You should have received at your place a legal communication from counsel as a proposed draft response to the appeal. As indicated in the communication, the initial response was a denial. As best I can tell, take a step back. This is a request made to the sheriff's office for information related to a traffic stop that the sheriff's office assisted the state police in. The initial request came in and was denied due to what I would characterize as a human error. They didn't locate the records and responded. Subsequent to that, the appeal was issued. They reviewed it further. Did indicate that there were dash and body cam videos as well as a report that had been submitted. Attempting to resolve it, they contacted the requester, who subsequently submitted an appeal, which is before you. And as noted in the communication, there were additional requests made for records that are the state police records. They are not county sheriff's office records, so those are the basis for denial. The records of other agencies that aren't possessed by the sheriff's office. The recommendation, as indicated in the memo, is to grant the appeal in part, which would be for the records that exist, subject to redaction of exempt material, specifically privacy exemptions and statutory lien exemptions, as well as deny the portions of the appeal that relate to records that are either insufficiently described and/or not records of the county sheriff's office. I will entertain any questions that you may have.
Questions, anybody?
So what's the motion?
Motion to grant the appeal in part and deny the appeal in part as recommended by council.
If it's appropriate, I'll make that motion.
Is there support? Support. Now, is there any other questions?
I have one question. So just so I understand this, basically, the information that can be supplied will be supplied, the information that's not appropriate to be supplied is not being supplied, and that is what this motion is for.
I would expand, you are correct also, but I would add that are records that are not the counties that are being denied by the county, such as dash cam footage of the state police. That request would need to be made of that agency, not through the sheriff's office. So you are correct, but with the additional caveat that there are records.
Not our information. Okay,
Correct.
thank you.
And when it's at the wrong place, do we direct them where to go, or is that just on them to figure?
That one, I believe, was submitted simultaneously to both agencies, but it was addressed the same way. So we, as a matter of course, address all of the aspects within the request. I would assume that the state police will also do the same.
Any other questions? Okay, all in favor?
Aye.
All opposed? That motion is carried.
John, give me your thing there, please.
Next up is the approval of the commissioner's expense accounts. Commissioner again.
Yes, I approve with the chair and the clerk's approval. I have moved to approve the expense accounts for the commissioners.
Support.
All in favor?
Aye.
All opposed? That motion's carried. Committee meeting reports, public safety.
All right, no action items out of Public Safety Committee meeting, but we did receive a update on the Child Care Fund overview from Todd Campbell. And we also got an update on the Child Care Fund update from the Department of Health and Human Services from Rebecca Anderson. And then an update on the Child Care Fund from the Juvenile Court from Jennifer Richards. And that was it for our committee.
Okay. Next up, Ways and Means.
Yes, we have a few items here. So first one on the docket, I am moving to approve the submission of the grant applications to the Opioid Settlement Advisory Steering Committee for opioid settlement funds for the Journey Court Program and Veterans Treatment Court.
Is there support?
Support.
This will be a roll call vote.
Commissioner Showers.
Yes.
Andrews.
Yes.
Washington.
Yes.
Pickus.
Yes.
Rudat.
Yes.
Burdick.
Yes.
And DeLon.
Yes.
7 ayes, 0 nays, motion carried.
Next up is, I move to recommend approving the resolution for adoption of final county equalization and appointment of representatives at the state equalization for 2025.
Support. Been moved and supported. It'll also be a roll call vote.
Commissioner Andrews.
Yes.
Rudat.
Yes.
Pickus.
Yes.
Showers.
Yes.
Burdick.
Yes.
Washington.
Yes.
And DeLon.
Yes.
7 ayes, 0 nays, motion carried.
Next up, Central Dispatch. I move to recommend authorizing the Clinton County Freedom Application and User Agreement for Fire and Emergency Medical Service Agencies.
Support.
Can I add to it? Project cost not to exceed 200,000?
No, different one, sir.
Oh, sorry, I'm on the wrong one. That's the next one. I'm getting carried away. It's been moved and supported.
Yep.
All in favor?
Aye.
All opposed? That motion's carried.
This is a CPI request, Fire Priority Dispatch System Protocol. I move to recommend approving the purchase and implementation of the Fire Priority Dispatch System Protocol EFD software with a total project cost not to exceed $200,000.
Support.
Any questions? This will be a roll call vote.
Commissioner Washington,
Yes.
Fickus,
Yes.
Showers.
Yes.
Andrews,
Yes.
Hudakian,
Yes.
Rudat,
Yes.
and DeLon.
Yes.
7 ayes, 0 nays, motion carried.
Next up is for computer-aided dispatch, refresh, and upgrades. I move to recommend approving the central dispatch request to complete the computer-aided dispatch refresh and upgrade project with a cost not exceeding $200,000.
Support.
Any questions? This will also be a roll call vote.
Commissioner Hudakian,
Yes.
Rudat,
Yes.
Fickus,
Yes.
Showers.
Yes.
Andrews,
Yes.
Washington.
Yes.
And DeLon.
Yes.
7 ayes, 0 nays, motion carried.
Next up was the quarterly budget update. I am moving to recommend approving the proposed 2025 budget adjustments as presented.
Is there
Support. Support.
Any questions? All in favor?
Aye.
All opposed? That motion's carried.
Let's see, next up. The committee meeting calendar. I move to recommend approval of the May 2025 open meeting and event calendar.
Anybody have any questions? All in favor?
Aye.
All opposed? That motion's carried.
And lastly, I move to recommend authorizing the request to increase the sheriff's office patrol vehicle fleet by 2 vehicles and authorize funding up to $20,000 for the purchase of necessary equipment for 1 additional vehicle.
Support.
Been moved and supported. Anybody have any questions? Be a roll call vote.
Commissioner Fickus,
Yes.
Showers.
Yes.
Rudat,
Yes.
Hudakian,
Yes.
Andrews.
Yes.
Washington. And DeLon.
Yes.
7 ayes, 0 nays, motion carried.
That concludes the Ways and Means report.
Thank you, sir. Move next to Human Resources.
All right, first up, we want to recognize our public safety officers and put forth resolutions for Public Police Week and Correctional Officers Week. These folks work hard, they put their lives on the line, and they are very good at what they do. Make a motion to recommend authorizing the resolution of appreciation of Clinton County deputies and command officers during National Police Week, May 15th, and Clinton County Correctional Officers employees during National Correctional Officers Week, May 4th through 10th.
Support.
Any questions? This will be a roll call vote.
Commissioner Showers.
Yes.
Andrews,
Yes.
Washington.
Yes.
Fickus,
Yes.
Rudat,
Yes.
Hudakian,
Yes.
and DeLon.
Yes.
7 ayes, 0 nays, motion carried.
Next up, we have permission to fill a position in the Central Dispatch Office. They've got a tenured lead technician who has given the word that they're going to retire at the end of the year. And to preemptively make sure that someone is in place that is well-trained and can replace them, as well as backfill another position that's open, that we're going to start on that now. I move to recommend authorizing Central Dispatch to post, fill, and hire a lead telecommunicator during the 2025 fiscal year in anticipation of the lead telecommunicator's retirement. In addition, if an internal candidate is chosen, Central Dispatch may post, fill, and hire a telecommunicator to fill the internal vacancy.
Been moved and supported. Anybody have any questions? All in favor?
Aye.
All opposed?
Next up,
Motion's carried.
Sorry,
That's
just
okay.
moving right along. Next up, we have a planning request. We've got a planning member, Tanner White, who is going on leave with the National Guard. He did not expect to go on leave so quickly, but with what's going on, he has been called to duty, and we wish him well in that endeavor. And I will say that we will not have to pay his salary at that time. He is covered by the National Guard. And what we'll do is to make sure everything's moving smoothly in the county, we're looking to contract services to support that office until his return. I move to recommend approving the proposal from OHM Advisors as presented and authorize the county administrator/controller to sign all necessary documents.
Is there support?
Support.
Brian, can I have it?
Anybody have any questions? It's a roll call vote?
Commissioner Rudat?
Yes.
Andrews?
Yes.
Showers?
Yes.
Pecos?
Yes.
Washington?
Yes.
Hurricane?
Yes.
And DeLong.
Yes.
7 ayes, 0 nays, motion carried.
Last up is appointments, committee appointments. I move to recommend reappointing Deborah Green to the Library Board for a 5-year term expiring June 30th, 2030.
Support.
Is there any other nominations? Hearing none, all in favor?
Aye.
All opposed? That motion's carried.
That is it.
Any commissioner comments? Anything?
So the gentleman that's at the planning commission who's going to be deployed, I know from being in the service that all service members love to get a box of food or candy or anything like that. So I don't know if we could put together a little fund to do that. I know he's going to be in a couple different places, but I don't remember exactly where those are.
Care package.
Care package.
I personally have no problem with it. It'll just have to be our own personal money.
Mhm.
So if you want to head that up,
Sure.
let's get with everybody.
I'll do that.
All of us get to contribute to the flower fund today, so we could add it to that.
I paid that last week.
She hasn't cornered me yet. She will today, so.
I do. Prosperity Region 7 was awarded a mitten grant by the High Speed Internet Office, and that includes Ingham, Clinton, and Eaton. And I've been working with their broadband task force in Ingham to connect resources with a train the trainers model, meaning we're looking for community anchor institutions such as libraries, hospitals, CMH counts, township offices where people can go to learn how to use the internet, learn how to look for your resources and connect with different things, and it's fully funded. And so I look forward to being able to sort of add some value in that respect.
Thank you. Commissioner Showers?
As is contrary, I really have nothing to say today.
Well, thank you, sir.
Are you feeling okay?
Commissioner Washington?
I'd just like to say that the Tri-County Office on Aging is having their annual fundraiser on June 11th, so any golfer who wants to support senior citizens, this would be a great opportunity to get exercise, have some fun, and build community. Tri-County Office on Aging, June 11th golf tournament,
Where's the golf tournament?
Forest Acres.
Anything else?
No, sir.
Commissioner Hurricane?
Yes, I would just like to remind the board here, as I started out, talking about our Board of Commissioner meetings and moving them to the evening, that is still something I'm hearing quite a bit from my constituents amongst other individuals throughout Clinton County. I will be bringing this up to us board members and for discussion sometime next month. I'd also, if this is something that moves forward, the possibility of starting those evening meetings in July. So that would be towards the end of July for our Board of Commissioners meeting. I'm hearing a lot and looking at the amount of individuals that are tuning into the live stream 5 with several, 85 viewing afterwards and in the evening. I think this would just be a wise decision, not only for transparency, but moving agenda items forward and to give our public input into what we're doing here as a board and into our county. I think that's very important, and allow people to have a voice in their government. So That is it.
Mr. Ruda?
Just thank you to Supervisor Stroud back there for attending our meeting today and for your comments, and proud of the work you're doing down in Eagle. Thanks. That's all I have.
I don't really have anything for this morning. Anything else from administration?
No, sir.
We are adjourned.